Hi, my name is Dr. Ross Hauser. I'm here at the Caring Medical Florida office. One of the more common conditions that we see at Caring Medical is severe migraine headaches. I'm going to show a digital motion x-ray that we did on a patient from Europe who flew in, a physician who had a whiplash injury from snowboarding and then windsurfing in 2011. The patient actually has migraine headaches every day, horrible pain behind the eyes, terrible neck pain. He's got clicking, grinding, and crunching in his neck. And it's going to be fascinating to watch his digital motion x-ray, so why don't we start it now? What you see right away is tilting of the C1 vertebrae. Like, look at this, like it's tilted throughout the full range of motion. And this is one of the first signs that we see that a person has upper cervical instability. In the open mouth view, we're looking for several things. The first thing is symmetry of the C2 vertebrae. This is the dens, and the spinous process should be aligned with the dens. And in this particular patient, we notice that it's shifted to the left. This is the reason that the person has migraine headaches primarily on their left side. That shift can easily be corrected with prolotherapy. We also see that this is the C1, C2 facet joints. We're going to look for overhang, and the periodontoid spaces should stay the same as the person moves their head from side to side. So now we'll look at his actual scan. And we first see that he's very hesitant to move, which this was the initial scan, so he was in a tremendous amount of pain. We start to see that the periodontoid space on this side gets more narrow than that side. You see a little bit of overhang. And then what we'll see is when he shifts to the left, we see there's a definite asymmetry of the periodontoid space. So this particular patient doesn't have overt symptoms of C1, C2 instability, but they're very subtle. But these subtle changes can lead to a lot of symptoms. This particular patient, after his fourth treatment, was doing spectacular, and he's back to work and functioning really, really well, and his headaches are now minimal. He'll need a couple more visits to hopefully get resolution of all of his headaches and neck pain, and the crepitation and clicking in the neck is basically gone.